Hey guys, it's Gabe. I just wanted to do an update on how I'm healing from top surgery and what that experience was like. I know that I've posted a couple of videos from when I was in Florida right after surgery. So you kind of saw my unveiling, but you haven't seen my chest since. Essentially, I'm at almost a month post op on Thursday. So in 2 days, I'll be a month post op. And this is what it looks like. So, I don't know. It's not the best camera. Basically, that's my one side there. Now, this side is doing, I think both sides are doing really well. There's a little bit of puckering right here, but that has been steadily smoothing out, and Germonius assures me it'll smooth out more from there. Um, this side here is still a little bit of like, still just kind of raised, but it's not like a serious dog ear or anything. You guys can see that. Um, this other side, the incision is doing really, really well. There's really no puckering, no dog ear to speak of. It's just kind of looking great. Also, I'm not sure if this is like the best lighting. I don't really want to show you my nipples in too much detail because they still kind of freak me out just because I'm like not too good with injury. Um, Maybe you can see that. Basically, all the stitches in this nipple are gone. It's pretty much healed. It's getting raised. It's doing really, really well. No discoloration. This one's not doing as hot. It's basically like there's still some scabbing on it. There's about 5 stitches left in it. And the nipple itself is like sort of discolored. I don't know if I'm going to lose it. Like the areola, I think it will be fine. But the actual nipple itself, I'm kind of emotionally preparing myself to maybe lose it. I don't know what's going on with it. It could just be some scabbing. I've been kind of worried about losing a nipple the entire time, but also kind of emotionally resigned to the fact that it could happen. So, yeah, so, I mean, if it does, at least it's better than what I had going on before. um, so I'll update on that. I assume the next couple of weeks will be the make or break it for that one. But all in all, yeah, I feel really, really great about my chest. It's everything I could have wanted. Yeah, I'm starting to get full mobility back. I mean, to be honest, like after the first, like after I got my bandages off, I've been pretty active right off the bat. Like I didn't really. It's been hard for me to follow the directions to not lift things or to like basically go easy on my upper body because I haven't been in any pain at all. So and my mobility's been really good. Um, so because of that, I find that I've been like lifting things that maybe I should be lifting. I know that the reason, well, I think that the reason that we're not supposed to be lifting things is so that we don't like rupture things or lose stitches, that sort of thing. But so far it's been fine. Like I've been able to lift like between 5 and 10 pounds since I got back. Um, One thing that I feel like I've been going a little bit like I've been sexually active like almost as soon as I got back, and I feel like that has been something that's been causing me to be more active with my upper body than I necessarily should have, and I'm not really being as careful as I think I could be with that stuff. Um, I don't know. It's tricky. I wasn't really sure what to do in that regard, um, or how long I should abstain from doing that, from being sexually active after surgery. But I've been making it work, and everything's been okay. I don't think that my activity level has been the cause of this nipple not healing well. Um, I think that rather like this nipple looked rough as soon as I got the bandages off. Like, of course, they both look rough, but this one I was like, I almost couldn't discern what was the areola and what was the nipple, and it looked a little bit muddled. So I feel like I was prone to having complications with it from the beginning, and that's what I suspect, anyways. Um, but yeah, I mean, other than the physical healing and stuff, when I got back, I was really scared about postoperative depression while I was away from home. Turns out I needn't have been because while I was away from home, that was the easy part. I was on painkillers, I was doing fine. I mean, the bandaging and being wrapped up and everything was really, 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 really hard. The healing process was really hard, but I wasn't sad. I was kind of like plugging through, a little bit bored, but mainly excited. Got the bandages off. It was a huge relief. And also, like, when I first looked at my chest, um, it was like, I don't know, I had this intense sense of vertigo, like, just like, I don't know, I felt almost dizzy. Like things like I was looking at something, my brain knew how it was supposed to like how like it was used to seeing it, and suddenly it didn't look like that anymore, and it was like just like I could feel the parts of my brain like clicking into place to accommodate this new sort of body configuration. So it was a really interesting sensation, and also super exciting, and then also really hard because suddenly I was looking at like these wounds on my body. So um, the unveiling process was like kind of like complicated for me. Like a lot of people talk about it, it's like, and suddenly there was my chest, and that's like just how it was always supposed to be. Whereas for me, it was like an enormous sense of relief and like, yeah, this is how my chest is supposed to look, and oh my god, it looks so good. And then also like, oh my god, wounds. Like I struggle with that. And then also this sort of like realigning of like how I've looked at and seen my body. And I think that a lot of that is like when I look at myself shirtless before, like I wouldn't see anything. Like I'd look around the parts that I didn't want to see, and so I was like not used to seeing, not used to like looking at my entire chest, and then suddenly I'm like seeing the whole thing, and it's how it should look, and like so it was really really experience like really really powerful experience. And yeah. Anyways, so since I got back, a couple days after I got back, I started getting kind of sad. I started like was really really worried about my chest and like my incisions now that everything wasn't kind of bandaged up and it was on me to change my bandages every day. Like the first time I changed my bandages, I was like very short of breath, and it was really intense. But and so I got kind of sad. I think I might have been a little bit depressed for a couple of days when I got back, because of just the sensation of feeling vulnerable and injured. Um, and yeah, but then I started feeling a lot better, and I just kind of distracted myself, and that went away. And now, yeah, I just feel like happier than I've ever felt. Like in respect to my body, it's like I don't know. It's just I just feel great and I feel sexy, and it's just like so liberating. And I just wake up and put a t-shirt on, and it's so great. I'm gonna be really really happy when I no longer have to put the bandages on my nipples, like, and the gauze stuff, because I don't like it smells medical and I don't really dig that. And it's also like just a huge pain in the ass. I don't really know how long I'm supposed to be doing it for, like if I'm supposed to continue it past the 1 month mark, but I assume that I'll just keep doing it until my nipples look healed, and then yeah, just go from there. um, yeah, and then I'll be able to work out again in like 2 weeks, and I'm super excited for that because one really hard thing for me has been not being able to work out. I feel like I'm losing a lot of muscle mass, and I feel kind of like I'm getting skinny and soft in ways that I don't really like. But overall, I think I anticipated like more drastic um, muscle loss than I've had so far. I know there's 2 more weeks, but I mean, I'm still like I still got some muscle. I've got like skinny boy muscle. I talk about like I'm not totally naked. I'm wearing underwear, but yeah, it's just like I don't know. I feel like I've gotten skinny in some ways that I don't really like. And Charity talks about me having skinny boy abs, um, but yeah, and it's kind of true. And my chest, like I'll show you it from the side. Like it's like it's pretty awesome. Like I like putting on like I went and bought tight t-shirts immediately, and I find that when I'm wearing tight t-shirts, I do a lot of like just like looking at my own chest because I can see the contour of my pecs through the t-shirt. And it looks like it looks like I actually have like some decent size pecs, and it's just like really cool. Like I just can't get over it, you know. And I keep telling Charity to like gently cup my pectoral and like just feel that it's there, you know. Um, because like it's weird how much it's weird specifically how much different t-shirts and stuff look, just not having like the sort of like binding, like the sense of there being mass right here. um yeah. Anyways, so that's pretty much all I'm going to update on now. I mean, life lately has been good. It's also been complicated. There's been some tough stuff going on for me still, that I'm not going to get into, but stuff that's been kind of distracting from how profound and wonderful top surgery has been. Um, but hopefully that all calms down soon. I mean, I think I'm due for a really good summer. Like, I've put in my bad news and bad times stuff, and hopefully my top surgery is like, sign of like things looking up, and all the peripheral stuff hopefully will sort of fall away, or I'll get control over it, and everything will be good. I mean, I'm working, I've got top surgery, things are way better than they were 6 months ago. So yeah. Anyways, that's basically how I've been the past month or so. I hope everybody out there is doing really, really well, and I wouldn't be here without people's support on YouTube, online, on Tumblr, and the support of my friends. Um, it's like so much of this was raised through donations, so I cannot thank everybody enough. Anyways, yeah, I will check in again very soon. Okay.